I'll start with our daily update on testing and positive cases and hospitalization numbers. Yesterday, over 14,300 tests were reported to DPH, which brings us to a total of over 424,000 tests conducted so far. The positive test rate for these tests was around 12%, which is in line with the positive test rate percentages we've seen over the last week or so. We're cautiously optimistic about this number. It's obviously down significantly from where it was in the middle of April, but we're going to continue to keep a close eye on it. As we outlined yesterday, we're submitting our plan to the federal government later this month to further increase our testing capacity to 45,000 tests a day by the end of July and 75,000 tests a day by the end of December. And the Department of Public Health has updated its guidelines to expand the number of people who can get tested, and the Division of Insurance has provided guidance to insurers about payment of testing for symptomatic and asymptomatic individuals who are identified as close contacts of those who do test positive through our contact tracing program. Going forward, more people who are close contacts, people with mild symptoms, and other frontline workers can expect to get tested. Pushing forward on testing will be a critical part of getting Massachusetts back to work, while at the same time continue to track, contain, and battle the virus. And we're pursuing measures every day to meet these goals. There were 1,685 new cases reported yesterday. The percentage of cases that are currently hospitalized is down to 3%, which is trending in the right direction, and we have 242 fewer people hospitalized from COVID yesterday than the day before. We still have over 2,800 people, however, who are hospitalized from COVID here in the Commonwealth, but fortunately our hospitals have been able to withstand the surge and continue to be able to care for everyone who's seeking medical attention. But we're still one of the hardest hit states in the country, and we continue to have daily conversations with our leaders in the healthcare community to monitor these numbers and get updated from them on what they're seeing every day on the ground in their own institutions. On personal protective equipment, we've distributed over 10.6 million pieces of PPE, including masks, gowns, gloves, and ventilators to frontline workers, first responders, and healthcare workers. We'll continue to work tirelessly to get as much PPE as we possibly can to ensure that our workers who need it most have the protection they need as they continue this fight. As we work to plan for a phased reopening of the Massachusetts economy, we've been in constant communication with the private sector about how they best prepare their workforces for the next phases. An important part of this conversation is centered around continuing to give employees the ability to work remotely or work from home. We're grateful for the private sector's incredible flexibility, creativity, and willingness over the past few months to step up with creative solutions for allowing their workforce to work remotely. Now, as we look to the weeks and months ahead, we're urging businesses to continue to promote remote work and work from home as much as possible. We know there's no one-size-fits-all approach to this. Not everyone can work remotely, and some employers will be required to have their employees physically report to a place of employment to fulfill a shift, operate a machine, or take care of customers. But there are hundreds of companies and thousands of employees who are now successfully working remotely. And as we start to transition to slowly reopening our economy, it's become more and more critical for remote work to continue so that we can continue to fight COVID-19 and prevent the spread of infection. Public health experts have made clear that large numbers of people in enclosed spaces is exactly how this virus spreads. That's part of the reason why many of the general guidance that we've put out there to businesses as we go through this reopening process from the Reopening Advisory Board make absolutely clear that distance at work will be a fundamental requirement for everybody. We all know that COVID-19 is highly contagious, spreads through droplets, or can live on hard surfaces and can be transmitted if people are in close proximity. Since late March, approximately half of the executive branch workforce that works with the Lieutenant Governor, myself, and our cabinet has been working remotely or working from home. This week, we extended our current policies with respect to remote work and working from home for the foreseeable future. And today, we're pleased to announce a growing list of employers committed to continue their work from home policies and remote work policies for the foreseeable future as well. These companies include some of the largest employers in the Commonwealth. Companies like Blue Cross Blue Shield, Raytheon, Wayfair, MassMutual, and Takeda total around 150,000 employees. By extending work-from-home policies and remote work policies, employers in many cases are supporting their employees, especially those who are at high risk, and at the same time fighting back against the virus by preventing more spread. We've heard feedback from many of these companies on the successes that they've had transitioning to more remote working, and I'd like to share some of what we've heard. At Raytheon, they're allowing half of their global workforce, about 100,000 employees, to work from home or work remotely. This not only helps them focus on protecting their employees that must work on site, but also results in fewer people being out in public, helping to minimize the spread of the virus. It also limits the number of people who are actually working on site. The new rules for everybody associated with work in an office are going to require people to create distance. One way you create distance and make it work is by not having the same number of people show up in the same office as you did before. To the extent the companies can find ways to make remote work or work from home work, even if it's only a few days a week, and if they can create a rotational process to involve that, it makes it much easier for them to create the distance that they are required to pursue under the order that we are issuing on Monday to make it work for them and for their workers. Blue Cross Blue Shield of Mass has 98% of their associates currently working from home. And while they're working on plans to reopen their buildings when appropriate, they're continuing their remote work arrangements for the foreseeable future. And at Takeda, they're continuing to support remote working wherever possible, which reduces both how many people are in their physical offices. Again, the distancing thing is critically important, and it also cuts down on the number who need to commute. I also want to say thanks again to all those employers who are coming up with strategies to work with us and with our administration to reimagine what their workplaces can look like and perform, and what we need to do with them to continue to adapt and fight the virus. But as we reopen the economy, we certainly anticipate that some state agencies will start to have certain employees return to the workplace on a full-time, part-time, or intermittent basis in the weeks ahead to help restart some state services that are currently paused, operating on a limited basis or being provided through a modified approach. Many of those government operations are critical to getting us all back to the new normal that we're shooting for, and we'll have more to say about the details on that soon. And we definitely appreciate all the work and the creativity and the imagination that our workforce has put in over the last couple of months to keep the executive branch operating during these very unusual circumstances. I also want to give an update on the funding to support the Commonwealth cities and towns as they battle the virus that we put out yesterday. We gave guidance to local officials that represents around $715 million that we're planning to distribute from the Federal Coronavirus Relief Fund to cities and towns for eligible costs related to their COVID-19 response efforts. This aid is $502 million from the Commonwealth, and then direct support of $90 million to Plymouth County and $121 million to the City of Boston. That represents about 25% of the total funding the Commonwealth has received from the Federal Coronavirus Relief Fund. We also expect this funding will address incurred or expected eligible COVID-related expenses by cities and towns. And the Executive Office of Administration and Finance will continue to work closely with our local officials to distribute this aid, account for it, and make sure that all the reporting and documentation that we need to meet federal guidelines is taken care of appropriately and accurately. Earlier this spring, many people here know that we worked with the legislature to come up with a plan to move the tax filing deadline from April 15th to July 15th to give tax filers more flexibility during this crisis and match our extension to the federal extension as well. Today, I signed the legislation that will help finance this move and help protect this year's state finances. I want to thank Speaker DeLeo, Senate President Spilka, House Ways and Means Chair Aaron Michowitz, Senate Ways and Means Chair Mike Rodrigues, and the members of both the House and the Senate for making this bill happen during this particularly unusual part of the legislative session. And I think, as many people know, on Monday, our Reopening Advisory Board will be releasing their report on recommendations for a phased reopening of the Massachusetts economy. We know that everyone is more than ready for things to get back to normal, and believe me, so are we. As a housekeeping item, this weekend, our legal office will be posting a 24-hour extension of the essential services order we issued previously, which I think, as everybody knows, expires at midnight on Sunday. To be clear, this is simply a technical extension. It doesn't change anything. It just allows us to move to the next step, which we'll be outlining with you all on Monday. It's important to remember that we have plenty of things we can do in this fight against the virus. In fact, it's pretty much the only way the Commonwealth can move forward, and it will require everybody to continue to play their part. You've all heard me say this before. I'm going to say it again. Cover your face in public. Masks and face coverings can cut transmission down by as much as 80%. A simple cloth mask is almost as good as one purchased. And this is about protecting those around you as much as it is about protecting yourself, especially given the level of asymptomatic carrier that exists out there in the regular population. Maintain that 6-foot distance wherever you can. Everybody knows about that one. Wash your hands. The science is clear. Lots of hand washing, 20 seconds, simple soap and water kills the virus. And the fourth is to do everything you can to stay home if you feel sick. Do not go to work if you're not up for it. These things are the things that were within our control, and doing them every single day is a big part of how we defeat the virus. And finally, I'd like to end on some good news. Starting today, the Command Center has launched a virtual map where residents can easily locate a testing location in their area. We currently have over 250 testing sites throughout the Commonwealth, and this tool will help people easily find a testing site close to them if they need to be tested. If you have symptoms of COVID-19, have been in close contact with someone who has COVID, please get tested. To the residents of the Commonwealth, I just want to say once again, thank you for doing your part. It's about getting that job done that's made so much of a difference so far, but we obviously have work to do. We've asked a lot of you during the past couple of months, and you've shown the best of what Massachusetts has to offer, and I thank you for that, and we look forward to continuing to fight this virus as we reopen going forward.